Children have to come here because they need us to do various tests to help in diagnosing their conditions and to monitor the progress of their conditions, and then we investigate them, and then we follow up the treatment to see if it's working and to follow up the conditions to see if they're getting better or worse.
Children with cancer have a dreadful time. It's devastating, it turns the whole of life upside down, and what we can do is to smooth it out a bit, to be a safety net, to be an emotional support.
Hi, I'm Tom. I've been coming to this hospital a lot, but today I'm going to be showing you something new, something awesome. Welcome to LATCHmosphere.
Well, LATCHmosphere is an ambient lighting system throughout the radiology department which gives a wonderful atmosphere for the children when they come for their examinations. So we've got sound, we've got lights, we've got different projections that the children can choose.
We're delighted that we've been able to make this provision for children through the generosity of the Welsh public towards Latch. So Latch and the atmosphere come together to call it the LATCHmosphere.
The idea of LATCHmosphere is to provide a full immersive environment for the children when they come to the department. As soon as they come through the door, they can see the colours and the lighting.
The lights are visual images that are actually changing. And they're not only changing in a timely manner, they distract therefore your mind away from what you're exposed to.
Each room that they go into, they can take charge of the examination, they can select what they want. So for the first time, they'll actually be able to choose the environment, choose the music, and take over, because many of the things that happen to them in hospital, they have no choice. For the first time, they'll actually be able to control their environment, and that seems to make a big difference. And it means that they actually forget that they're having a test, they're much more cooperative and enjoy the experience.
I know how awful an experience to be a child with cancer is from the experience of within our own family, because they go into rooms that are full of machines that they don't understand. They sometimes have to leave mum outside, and therefore anything that we can do to ease their passage through this necessary and life-saving procedures is something that we need to do. And Latch exists in order to make that experience a little bit better.
We find the children come running in, they want to choose what they have on the ceiling, what projections they have. They're excited, they're laughing, and they forget that they're having a test. It's more like an exciting time.
You have to be still, absolutely still, otherwise the images are blurred.
We've got a very long waiting list for anaesthetics, and one of the big drivers was to try and get younger and younger children into the scanner without an anaesthetic.
An anaesthetic is associated with a period of starvation. Usually children on cancer therapy are always skinny, and we're worried about their food intake and calorie intake anyway, and then we starve them purposefully, which is counterproductive in a way.
For my scan, I used to have an anaesthetic, which means I wouldn't be able to have breakfast. But now I don't need an anaesthetic because of the lights, and I get breakfast.
And a lot of children have reactions to anaesthetic drugs that are not pleasant. So they wake up cranky, scared, some have really bad dreams during the wake-up period because they're not quite aware what's happening, but the drugs make them feel awful. And if we can make the fears manageable by distraction through the treatment and while being prepared, then that would be very successful in reducing the side effects for the children.
We've got the new kitten scanner where they have a mock-up scanner before they go in, and they have a go with one of the toys and they learn a little story about what's going to happen to them. So we had a 4-year-old who actually lay there for the full hour without any anaesthetic, and we got perfect pictures. So we're very excited that we might reduce the number of anaesthetics from now on with very small children.
It's just a toy for them, but in reality it's a toy that's very educational. Recently a patient came back to the ward, and the family could not stop talking about all the exposure to the lovely pictures and the distraction it gave to their child. And that was a child who has always been worried about going to the X-ray department. It was like Judgment Day, and they were always very tense, and suddenly it turned into a positive experience.
One of the families always stands in my mind was a little boy who'd had cancer, and he'd first had cancer when he was 5, and he used to come back every year for another scan, and every time the parents came in the room they were shaking. They were so frightened that the cancer had come back, and they said to me that every time they come it's almost as bad as the first time. So it was a very, very stressful, very worrying time, and that made me very conscious that we need to make it a really sort of safe, pleasant place for the family to be, because it is a very stressful time for them.
So there's a facility also for them to bring in their iPlayer or their iPhones and so impose, if you like, their choice on the place where the experience is going on.
I think the most popular theme so far is the under the sea with the dolphins and the giant turtles swimming over the coral reefs. But some of the little boys, they really like the robots. We've got a chicken that they have to find in a farm, which is quite fun. Little girls like the Fantasia scene where there are lots of butterflies and coloured flowers.
It's unique, as we understand it, in the United Kingdom. And indeed, there are very few in Europe.
We're very privileged to have such an unusual facility.
They've got enough to worry about, and all we can do is smooth the path.
It's calm, it's relaxed, it's also fun, and the children are happier.
The idea is to change the experience of the children from something negative that has to be endured to something positive that can be enjoyed.